Welcome back to MedSpeak, everyone. I am so excited for today's episode. We're diving into something that sounds innocent but can be incredibly serious. Paget's disease of the breast. It can look exactly like eczema, right, Eden? Like, exactly?
That's precisely it, Avery, and that's why it's so important to talk about. It's often that hidden clue, a dermatological masquerade for something far more significant. We're talking about a rare form of breast cancer affecting the nipple areola complex, often associated with underlying ductal carcinoma.
Wait, cancer? Seriously? So someone could just be treating what they think is a rash for months and it's cancer? That's terrifying. Can you give us an example? Like, how does this actually play out in a clinic?
Exactly. Imagine Anjali, 54, a teacher with persistent itching and redness on her left nipple. No lump, no pain, just crusting. Her GP prescribes steroid cream for dermatitis. But here's the critical point. Weeks pass, and the rash doesn't improve. It actually worsens, becoming flattened with some bloody discharge. That lack of response to typical eczema treatment is the massive red flag.
Wow. So the key is really that lack of improvement with standard treatment. That's so crucial. And then what are they even looking for on that biopsy? Is it just like weird cells?
Precisely. On biopsy, we're looking for what we call Paget cells. These are malignant epithelial cells that have migrated from the underlying breast ducts to the epidermis of the nipple. They're large, with clear cytoplasm, and stain positive for things like CK7. The biopsy confirms the diagnosis, and then imaging, like mammography or MRI, is essential to find the underlying DCIS or invasive cancer, which is present in most cases.
So it's not just a skin thing, it's always connected to something deeper in the breast. That makes so much more sense. And if it's caught early, like if Anjali got that biopsy sooner, is the prognosis generally better? It sounds like time is really of the essence here.
Absolutely, Avery. Early diagnosis makes a significant difference. If it's just ductal carcinoma in situ, confined to the nipple, the prognosis is excellent, with a high 5-year survival rate. If there's underlying invasive cancer, treatment often involves mastectomy and adjuvant therapies depending on the specifics. The core message is this: if a nipple rash, especially in a postmenopausal woman, doesn't respond to standard treatment within a few weeks, biopsy it. Eczema improves, Paget progresses.